Good afternoon and welcome to Body Talk. This is going to be a program about suicide prevention.
Yeah, we're going to talk today about what leads people to have suicidal thoughts, different myths surrounding suicide, and how we can help educate.
Okay. And our guest today is Amanda Knipp.
Yes.
She's the Director of Woodland Center in Gallipolis. And welcome to the show.
Thank you for having me, both of you.
Thank you.
Okay, tell us a little bit about yourself.
Well, again, I've been with Woodland Centers for about the last 6 years. I've been practicing in the field for approximately 12 years, have my master's from Ohio University in their counseling program, and I'm ABD at this point with in the counselor education program. Married, have 5 children, and I just love what I do.
Okay. At Woodland Center, what do you see the most of? Is it more addiction or suicide or both, or what do you treat a lot?
Primarily mental health is what I think initially is what I would have answered 5-6 years ago. I think over the last 2 or 3 years, and Tricia can speak, we're seeing just more of co-occurring mental illness with substance use. And then suicide just kind of falls right into that. Many of the individuals duly diagnosed are actually a higher risk for suicide than those with just primarily mental health. So,
How does addiction play into suicide and having suicidal thoughts?
addiction typically, okay, one of my quote is that an individual doesn't seek suicide, to end their life, but to end their pain. Kind of that's I think that's what individuals with actively in addiction are seeking to do, is to self-medicate, to ease the pain that they don't know what else to do. But on the other side of that is individuals who are actively in addiction, it lowers their inhibition. They typically, at some point through, the longer they are in addiction, the more, the limited resources they have, the more bridges that they've burned. So they're very lonely and very hopeless at they get to a certain point. So they're 6 times more likely, individuals that are actively using are 6 times more likely to complete suicide than someone else with just primarily mental health.
Now, do you think, what's the antidepressants or those type of drugs? Someone told me once that the thing that makes that you more suicidal with those is that you don't care. It's not that it makes you think about suicide, is that you really don't care about living. It takes away the feelings, so you're like at a zero.
There is the idea that goes along with that once an individual, we usually typically think if someone is going to end their life that it's when they're at their lowest, but a lot of times it's when they're either thinking more clearly or they just don't care, or they know what life is like without the antidepressant. So things look different, they don't have the emotions, they're more numb, and they're actually thinking maybe more clearly, which makes them lead, quote, to the decision of ending their life. Which again, it's kind of, I don't want to speak completely to the medication aspect of that, but I do know that those are things that we know, that we're taught, that
you see a lot of these medications on television, and I don't know if it's mostly the antidepressants or a whole group of drugs that will say, increase thoughts of suicide. Now that's weird to have an antidepressant and then you have increased thoughts of suicide.
It's like, what's that? Sure.
And I don't want to speak a lot to medications either. I read recently that the first generation antidepressants could lead to suicide, or there was a higher propensity or chance to overdose on those medications, but now there's a second generation antidepressant line, like the Paxils and things like that really reduce that risk.
That are less likely to have that. And we see, I know with other medications that aren't necessarily antidepressants are starting to have some of those indicators of just, so I'm not sure exactly what is going on.
Like Chantix for
that's what I was thinking.
Nicotine, yes, that's...
Nicotine?
Yeah, people who want to stop smoking are prescribed Chantix, and it can lead to suicidal thoughts.
So it's better just to smoke, huh?
I won't say that.
I knew you'd back off of that.
No.
And I think
No.
it's definitely to say just taking that seriously, because if that is an indicated side effect, obviously that we're talking about it because it's there, and
Right.
that people around you need to be aware when we change medications. We always try to have a support system if there's, we're going to be adding meds or talking about changing meds.
So definitely talk with your prescribing provider about what's best for you on those
Absolutely.
things.
Is there a type of person that's more prone to that suicidal thoughts? Or
So we do know now that suicide is occurring as early as 7, 8 years old. We're seeing people taking their lives
Wow.
up until older adults. So it really doesn't. I think everyone is at risk for that. We do know that the majority of the suicides that occur, 90% of those do have at least one criteria for a mental illness. And then we talked about the risk of addiction. So you take someone who's duly diagnosed, they're going to be higher risk. The elderly, I think, is a really concerning statistic. It talked about, well, first of all, we have approximately 42,000 suicides in the United States and over 700,000 globally a year. And individuals in the older population, we're starting to see more of that. One of the statistics that we talked about a few months ago was 20% of individuals who are older individuals that completed suicide, 20% of them had seen a doctor, a primary care doctor that day. 40% had seen a primary care doctor within a week, and 70% of the older individuals who completed suicide had seen a doctor within a month. So
you think that's a diagnosis that they didn't like? You think, or a scary thing like, well, you got cancer, or well, you got this disease or that disease, and it's like, well, I don't want to deal with that, and so.
I think that plays a role. I think because we know loss is terminal illness, chronic pain, all of those are contributing factors to risk factors to why an individual may decide to attempt suicide. But I think the other thing too is I think it speaks to the importance of education and awareness, because we need, as primary care doctors, in that profession, and educate. Universally, we all need to at least kind of be aware of maybe what the side effects are, and you wonder what they're presenting with when they're at the primary care doctor, and do we need to start doing some brief screenings to kind of assess if there's any type of suicidal thinking or ideology. So, and it's harder for that generation to actually reach out for help, so we maybe need to start having that conversation with them as they're seeing the doctor. I know with some of the older women and men that I serve, that's not uncommon for us to talk about, because they are very depressed. A lot of them are more isolated. They're dealing with just
I was going to say,
the
are they
aging
more
process.
shut-ins that don't get a lot of visitors?
Yeah, I mean, we see
Like,
that.
why am I here? I'm just sitting here in the house and doing nothing.
Sure. I
That
mean,
could be part of it, yeah.
it speaks to people want to feel hopeful and feel worth, like they
What's
have worth.
going to
and
happen
needed.
tomorrow?
feel needed, yes. So,
Is there an age group that has a higher likelihood of completing suicide or are more at risk?
yes, well, we do. Suicide is the 10th leading cause of death across the entire lifespan, but it's the second leading cause of death among individuals 15 to 24. So,
What would be
Those
some
highly emotional years.
What would be some risk factors contributing to that age group that might lead to suicide?
at that, of course, again, developmentally, we know that the brain is still functioning, so there's more impulsivity, there's less decision making, less thinking through, and it's also a definition of the crisis that they're occurring. We may see a breakup or something maybe that we don't identify as significant, but that's very significant to people at that age. So when I have a 15-year-old that thinks their life is ended because they've had a breakup, I take that very seriously, because that's their perception of their reality. So, loss in a breakup, they're more impulsive. There could be maybe domestic violence in the home, emotional abuse, physical abuse, addiction, limited support in the schools. I mean, there's just multiple risk factors that can play into that.
Yeah, you hear those songs that, young people sing that, I can't live without you. It's like, well, try.
Yeah, that's
At that
That's
age,
true.
though, I mean, you really don't have a concept of life as an older adult. It's like here and now, and that's all I have.
Right.
So, I mean, it might seem like that's the end of everything.
they can become very hopeless. And when you think of a breakup, and that may have been their primary support, and there's just not a really strong support system in the home, there's just poverty, other things. And again, it's not just about a socioeconomic status, but still that is a risk factor that can play into that when there's just limited support and resources. And so a breakup, once that happens, I mean, that can be pretty significant.
Do you see a lot of people that threaten suicide a lot just for attention? And how would you tell between the ones who are like serious and the ones that are just like, hey, look at me, I need some attention from somebody?
Great question.
Well, I say this to the staff that we work with, and we all, that every threat is serious, so we take it very seriously. And there are individuals who may make that threat more often, but again, we do the assessment, we do what we need to do for an intervention, so we take it very seriously. And there is the idea that if someone is talking about suicide, they're needing something, so we need to ask ourselves, what is it are they needing? It may not mean that they're actually contemplating with a plan and intent, but they're needing something. They're needing some level of support, they're needing some level of attention, and they really may be suicidal. They may have a plan and intent. So again, if it's something that I hear weekly from someone that I may work with or serve, we take it very seriously and do what we can to kind of support and see it, think a little more critically about what's going on and what do they need.
Because like you never know, the person you think might be just wanting attention might actually go commit and complete, and you just don't want to take that chance ever.
Exactly.
Because I hear, if you're going to do it, you're not going to really say, I'm going to do it, you just go do it. That's what I've heard.
So these are really great myths, and I love educating the public on. What's some myths surrounding suicide that people often hear that might not necessarily be true?
That is one, that if they say it, they're not really going to do it. If they were going to do it, that's not a myth. We do know that the majority of people who have actually completed suicide have sought help and didn't get the help that they needed. The other is that if we ask them about taking their lives, or if they're thinking of killing themselves, that that will plant that thought and they will actually attempt suicide. And that's a myth. That's not true either. It is important to ask and have the conversation. There's a current initiative going on nationwide in different states, and it's the Are You Okay? And it's about conversation, and it's about asking, even if they're not talking about it. Sometimes we just have the conversation, and it's not going to make them more likely to attempt. It's actually going to be more helpful to them.
So people are afraid to ask that question, are you feeling suicidal? And what research says, and our experience has been, you need to ask that question.
You think they would tell you the truth?
Yes, I really do.
Yeah.
It's been my experience that if they really are, they will tell you.
I wasn't sure if that was something you would feel ashamed of, like, well, yeah,
I think that a person, and you can share too, Mandy, I think a person that is suicidal, that's a scary place to be, having those thoughts.
Oh, absolutely.
And a lot of people that are suicidal don't want to die.
Yeah, is that something you really, is that a goal? Or is it something you'd rather not do, but you feel like you have to do?
It is, and I think that that's where most people get is that, and asking also serves as a validation that someone recognizes that they're not okay. So when I have friends or just family that I'm okay to say, notice this is going on, notice you seem a little more down and quiet, what's going on? I may not say, are you thinking of killing yourself, but I'm also validating that I recognize something's going on, and are you here, and that I'm here, and do you need to talk? So it serves as a validation, but it also gives them an opportunity to say something they may not be able to say without being prompted. So it's good to ask.
Yeah. What are some resources? How can people that are suicidal get help?
Well, of course, in our community, we have Woodland Centers. There's multiple other agencies, Health Recovery. I mean, there's multiple agencies in our area that we have. We have I'm sure, hopefully everyone's heard of the text line that is through Ohio Department of Mental Health and Addiction Services, which is, you would text for HOPE to 741-741. We also have the talk line, which is equivalent to the text line, which is 1-800-273-TALK. And we have the the suicideprevention.ohio.gov website, which has tons of resources just for apps and support and knowledge. We have a crisis intervention, 24-hour crisis services with Woodland Centers, so we also have a crisis line that can be, you can reach us. We have Holzer, which you could, if you're seeking that, you would go to the local ER and you would seek services there, and they would have someone there that could screen you and help. And
what about calling 911? Would that be an acceptable use of that service?
I think if you have barriers to transportation, yes. I mean, I would say definitely use that because they will address that.
Else.
Yes,
Yeah.
call it because they will get help to you. If you call in and you're suicidal, they're going to get you help to get you where you need to go.
So the crisis text line, you actually text the number 4 and then the word hope to what number?
741-741.
Okay.
Yes.
All
So
right.
I have my bracelet.
Yes.
So.
Wonderful.
Right. We need to take a break, and we'll be right back. Welcome back to Body Talk, and we're talking about suicide and prevention. So I wanted to ask a question. Is there, I think you approached age. How about gender? Is there any difference in gender? Because I hear more men commit suicide than women.
Yes.
Okay.
Men have a higher completion rate of suicide, and that is because of women have more attempts, men have more success, and I hate to use the word success, but that's what it's considered as a successful completion. But it's because of the lethality of means. They typically will use a gun or a more violent use of.
I thought maybe that they didn't want to open up to someone or seek help because, you're weak if you would seek help, and women don't have as much a problem as that with that. Plus, you've also got a good group of men that have been in the military and have PTSD or what other type of problems.
And that brings up a good point, is gender roles and also like cultural issues. You know, I found in the Appalachian culture, maybe mental health isn't as valued as physical health, or there's a stigma attached that it makes you weak if you're depressed or have any kind of mental health issues. How does that play a role in suicide prevention?
I think that leads back to when you mentioned that they value maybe their primary health as opposed to mental health. So I think that's why it's so important that we try to educate the public for primary care providers to start doing more of that mental health aspect and assessment as well, because it may be addressed there. They may be the one on the front line that would catch that before we would, because it is more of a stigma in our area. I mean, we're slowly moving past that, but for men it is still a barrier. For individuals of Appalachia, individuals who are more isolated in just different regional demographic regions, have no transportation, all of those are barriers that would interfere with someone's treatment. So when you have the access to primary care, that may be some individuals' only way, in to start being assessed, and that's why the schools need to continue to do what they're doing. I mean, we're promoting awareness and education in the schools because they are also, for younger people, they're the ones that are there that see them sometimes and know them better than maybe someone in their family, or they just don't have the support. So I think a lot of that goes into not just making it about the mental health people who need to know what suicide's about, but extend that into our whole community, because that's really one of the most important things in prevention and awareness is our community and what we have.
I think there's for men that there's a lot less places to go. We have homes for abused women and places to go and shelters and all this. You don't have that for men. And even at the Fields of Hope, they are serving the female community and not the men. So there's like a dead end there that they can't get around.
I do know there's a domestic violence shelter locally that does help men as well, but they help women more primarily.
I am not familiar.
We'll have to look into that,
Yes,
Mike.
I was going to say I'm not.
Because I know that there's more resources for women
In our area. I'll say if you
Because-
go outside of our areas, there you can find resources for men.
Abuse is equal, I think, in a marriage, both ways. And there's no place for a guy to get away. They're stuck there.
And I think, that's always, it's seeing it for the big context of what's really going on. What are the resources that we don't have? What do we need to do to bring the resources to our area to get the people, whether it's men or older people or younger people, to get them the help they need? Because so many of that, even for young people, there's the mental health community services, but there's not a lot of inpatient resources in our area. So we do have some limitations, but I think we're moving in a good direction of trying to expand those. But it definitely is something to keep in mind of what plays a role.
If a parent or a family member or friend would come to you and ask, this person came to me and said they were suicidal, what would you tell them they can do? How could they help and get involved in helping that person?
That's a good question, because you would want to be able to support them, because that's hard for an individual hearing that as well. So you want to be able to validate that they're coming and they're taking it seriously. So you want to reach out to them, but you also want to kind of talk with them about the process, that if they're saying that, we really need to take it seriously. These are some of the options. I mean, obviously, getting this someone at the school or getting them into walking them into a mental health agency, to a hospital, walking them into where they need to be. Sometimes they may not have that access, but if it's, say that it's a parent of a friend whose friend said this, I mean, then you have to have the conversation. I mean, I've had to say sometimes, if they're saying that to you, you probably need to talk to their parents. You need to talk to someone. It's hard to put that pressure on them because they're feeling so uncomfortable with it, and it's an uncomfortable conversation, but it's a real one that needs to happen, and it's more important to talk about it than to not. So give them some options, validate and support them that this is hard on, this is difficult, but also we do have many resources to address the immediate need for suicide intervention.
And especially in the age of social media now, it's very easy to see someone write something on Facebook or on Twitter that's questionable, and you're left wondering, what do they mean by that? That sounds kind of like they might be suicidal. What do we do?
That's a good question.
Yeah.
You're asking
That's
good,
a
tough
difficult
questions. I mean, I know that we've had individuals brought into our agency who have posted something on social media that the schools or the school resource officer has identified as a concern, and they want them evaluated or to talk. They're saying, help us understand, and we're not sure what they meant. Just see what they're needing. If you're just as an individual, I mean, from experience, an individual a friend of mine that I went to school with had. Actually, I didn't see the post, and it really weighed heavy on me. He had made a post indicating that he was logging off, and just apparently it ended up coming off.
Sort of sounded more finalistic.
It was very, yes, and according to what people who had seen it, and he did shoot himself the next day, and he ended his life. And, I wonder, I think it's okay. I think it's okay to say, I'm here. And again, the initiative, are you okay? I noticed you said this. Are you okay? Now it puts us in a situation, if they say, no, I'm not, what do we do? And it's most important to get to the immediate access as possible. I mean, we say on our crisis, we do whatever we can. Their safety is most important. So we want to intervene and reach out and offer as much support as we can.
Absolutely.
How about living with somebody who you think is suicidal? I mean, you go around hiding knives and locking up guns and whatever.
I reckon one of the protective factors is reducing the means of lethality. So if you do have someone in your home, or someone who has a history of suicide, or has a plan and intent, I do recommend, being aware of what medications you have in your home, making sure that firearms are locked up and in a safe place, just being aware of your surroundings, because that is when they've made that decision, and if they have access to means, that is most likely when they're going to complete suicide.
Is it an impulse decision, or is this thought out over months? Because I've seen people make these traps for themselves so they can't go back on it. There's elaborate means that sometimes they go through. Or is it a snap decision?
Kind of both.
Both?
I would agree.
It can be both.
I think some people are more intentional and thought through and plan, and if there isn't, when we start seeing these red flags, if we don't know the red flags to look for, but then I think sometimes the pain is just so intense and the impulsivity is there that if they have access to a gun, they're just more likely. We want to be able to give them the time to talk to someone, to actually do some processing, utilize some coping skills, so it reduces the impulsivity and the likelihood that they'll end their life if they're having less access to.
So you said something about red flags. What are those?
There's many. Well, not many, but I want to encourage individuals that if you know someone in your family, in the schools, when you start to notice a sudden change in behavior, I mean, it can be gradual, but withdrawing, isolation, things on social media, giving away possessions, making finalities, just kind of wrapping things up, giving things away, talking about it, just really being aware, increase in depression, even an increase in a really elevated positive mood. You also have to think, okay, that's not typically...
Is that a manic thing?
It could just be that they've decided that's what they're going to do, and they're
A
okay.
sense of relief.
Okay, I have a plan now.
I'm going to do it,
A sense
and
of relief, yeah.
you know, I mean, I had a case that I use as an example, and I would, but I don't have a lot of time. But it was just that her entire behavior had changed, and after multiple indications and me checking in with multiple people in her life, we finally brought her in and she had admitted she had admitted that she was planning on ending her life. She was just closing out things with her family, getting along better, making them feel better, drew me a picture, drew her case manager a picture. Very different behaviors that we had ever saw from her.
So
And
you prevented this?
yes.
Okay.
Called her mom that evening, said, hey, I know this is kind of not sure, but these are things that I'm noticing. She even hugged me when she left, and she had never done that. And then I called the case manager, and we seen some other things, and then her mom agreed that she had been doing things with her brother and playing. So I said, okay, let's just check in with her, keep her safe tonight. Brought her in, and she became very tearful, and she was going to overdose, and she had a date, and it was on an anniversary date that was important to her.
Okay. So one more time before we leave, we're out of time. What are the numbers for resources in Gallia County?
Our crisis line, which would be 740-446-5500, and you would just extension 0. Our For Hope, text For Hope to 741-741, and then the Talk crisis line, 1-800-273-TALK. And then 911, of course, if you need immediate
Right.
support.
Okay. Well, hopefully this has helped and informed some people, and tomorrow's going to get better. So thanks for watching.